See Recap Medica in action. Imagine a solution that listens to your clinical conversations, automatically converting doctor-patient recordings into structured, precise Epicrisis documentation, all while ensuring your data stays secure and compliant with GDPR standards. Today, we're demonstrating how a cardiologist seamlessly records a consultation using his mobile phone, and how our system instantly prepares the patient's detailed Epicrisis.
Good morning, Mr. Anderson. Please, have a seat. How are you feeling today?
Morning, Doc. I've been feeling a bit off lately. My chest sometimes feels heavy, especially when I'm walking upstairs.
I am adding notes. Patient is a 58-year-old male presenting with exertional chest heaviness and mild dyspnea. No acute distress noted upon arrival. Okay, let's talk a bit about that. When did you first notice this heaviness? Is it more of a tightness, or does it feel like pressure?
I'd say it's like a squeezing pressure that starts when I'm doing any physical activity. It usually goes away after a few minutes of rest.
Adding this to my notes. History of present illness. Onset correlates with physical exertion, subsiding with rest. Quality described as squeezing pressure, suggestive of angina pectoris. No associated radiation reported. Do you ever get short of breath or feel dizzy when this happens?
Yeah, sometimes I get a little lightheaded, but nothing too dramatic.
Patient also reports mild exertional dyspnea and occasional lightheadedness. No syncope or presyncope noted. Differential to include stable ischemic heart disease. All right, I'm going to listen to your heart now. Please take a deep breath and exhale slowly, Mr. Anderson, okay? Adding notes. Auscultation. S1 and S2 are present and regular with a slight early systolic murmur at the apex. Grade 1/6. No gallops or rubs appreciated. Findings consistent with mild valvular turbulence. Your heart sounds are mostly normal, although I did pick up a tiny murmur. It's nothing to worry about right now, but we'll keep an eye on it.
Okay, that's a relief. What about my blood pressure? I've been worried it might be high.
Okay, let me see, Mr. Anderson. Adding my notes. Measured blood pressure is 142 over 88 millimeters of mercury, indicative of borderline hypertension. Recommend lifestyle modifications and possible follow-up for further evaluation. Mr. Anderson, I'm also going to check your pulse and listen to some additional heart sounds. Just relax and breathe normally, please. Oh, good. Then adding my notes, cardiac examination reveals regular rhythm, no arrhythmias detected upon palpation. Peripheral pulses are intact and symmetric bilaterally. No peripheral edema observed. Now, Mr. Anderson, can you tell me if you've noticed any swelling in your legs or ankles lately, or any changes in your weight?
Not really. I mean, my legs aren't really puffy, and I haven't noticed any big changes on the scale.
Adding notes. Patient denies peripheral edema and significant weight fluctuations. No signs of congestive heart failure at this time. Okay. Well, how about your lifestyle? Do you exercise regularly, and do you still smoke, or have you quit?
I quit smoking about 5 years ago. I try to go for a walk when I can, but I won't say I'm super active.
Adding notes. Past history, former smoker, quit 5 years prior. Current physical activity is moderate at best. Family history significant for coronary artery disease. Father had myocardial infarction. Mr. Anderson, that's very good to hear about quitting smoking, though I do see we have a few risk factors here. Given your symptoms and your family history, I'd like to schedule a stress test and an echocardiogram to take a closer look at your cardiac function.
Sounds like a plan, Doc. I was a bit worried, but I'm glad you're taking a careful look.
Adding notes. Plan. Order a treadmill stress test and transthoracic echocardiography to assess for inducible ischemia and structural heart disease. Continue monitoring blood pressure. Consider initiating antihypertensive therapy if levels persist. Before we wrap up, is there anything else bothering you? Any chest discomfort at rest, palpitations, or other unusual symptoms?
No, not really. It's just the exertional stuff that's been annoying.
Adding notes. Patient reports symptoms exclusively with exertion. No episodes of chest pain at rest or palpitations. Overall, clinical presentation aligns with stable angina in the setting of borderline hypertension. Great! I'll arrange for your tests and we'll follow up as soon as the results come in. Meanwhile, try to keep up with your walks and watch your diet. We'll work on keeping your blood pressure in check too.
Thank you, doctor. I appreciate you taking the time to explain everything.
Adding notes. Final impression: 58-year-old male with exertional angina like symptoms, mild systolic murmur, borderline hypertension, and significant family history of coronary artery disease. Recommended further diagnostic evaluation with stress testing and echocardiography, alongside lifestyle modifications. Patient advised regarding risk factor management. Thank you. I have added my notes, Mr. Anderson. Take care. We'll see you soon for your follow up. Have a good day.
Thanks, doctor. See you soon.
Once the consultation concludes, Recap Medica gets to work. In real time, our platform transcribes and processes the conversation, converting it into a comprehensive epicrisis. This detailed clinical documentation not only saves time but also enhances the quality of patient care by ensuring every important detail is captured and stored securely. Recap Medica transforms clinical workflows, saving approximately 6 minutes per encounter, improving work-life balance by 65%, and elevating documentation quality by 80%. With a more conversational and attentive approach, both doctors and patients benefit from an optimized experience. Discover how our demo app can empower your practice. Experience the future of clinical documentation with Recap Medica. Visit our website, try out free demo, and see how easy it is to transform your daily practice.